Hey everybody, I'm Will Martin, family nurse practitioner who works in the emergency department, and I get asked this question quite a bit. What is an emergency nurse practitioner? So my short answer is that it's a nurse practitioner that works in the emergency department, but we know that it's probably a little more complicated than that. So let's talk about it in this video. So before we get started, thank you for watching this video. And if you can subscribe, I would appreciate it. And if you can hit the like button, I would appreciate that as well. So let's talk about what is an emergency nurse practitioner. Well, first of all, it's variable depending upon what state you're in and what hospital you're in, because regulations can vary between states and certainly between hospitals. And of course, medical staff bylaws will affect what the scope of practice is for an emergency nurse practitioner. But in general, a nurse practitioner working in the emergency department is going to practice emergency care or emergency medicine. Now, that gets into some muddy territory because, first of all, there are some nurse practitioners who work alone in emergency departments. Here in New York State, we have some hospitals that are low capacity, low bed numbers, and there is a provision in the law that allows nurse practitioners to work independently and alone in an emergency department. So there are some settings where the NP is the only game in town, so to speak. But for the most part, most emergency nurse practitioners work in emergency departments alongside physician assistants and emergency physicians. So the first question you may have is, what is it that we do? Well, again, it depends upon what your scope of practice is allowed to be in that setting. What we're capable of doing is pretty much whatever we're trained to do. Our legal scope of practice is pretty broad. First of all, you have to be a family nurse practitioner to practice in the ED if you're going to work in an ED that sees all ages. Now, in one department, our main trauma center downtown, we have a pediatric emergency department. And so you can theoretically work in the downtown emergency department adult ED and not see kids. So, technically you wouldn't have to be a family nurse practitioner. You could be an acute care or an adult nurse practitioner and get along okay. But there's always going to be the chance that a pediatric case may have to be seen in the adult ED. Also, we have other campuses that are more general hospitals, and you're going to see everything that comes in through the door. So you have to be a family nurse practitioner. Now, there is a board certification for emergency nurse practitioner, that's ENP. And in order to sit for that board exam, again, you have to be a family nurse practitioner first. So people will ask, well, like, what kind of procedures do you do? Do you intubate? Do you put in central lines? Do you do lumbar punctures? And the answer is yes to all of those. How often you do it really depends, again, upon what setting you're in. In our main campus downtown, it's an academic teaching center. We have residents who have to get those procedures in. So typically, the resident physician is going to get the LP or get the central line or do the intubation before the advanced practice provider, i.e. PA or nurse practitioner, does. However, there is one day per week where the residents are in conference. And on those days, one day a week, Wednesdays, anything goes. And typically I'll work those days because that's when you'll get your opportunity to intubate or do a central line or do an LP or whatever other procedure you're credentialed to do. And that's the other thing, is that you have to be credentialed to do these procedures. It's not part and parcel of your training as a nurse practitioner to learn how to put in a lumbar puncture, central line, or anything like that. So it is something that you have to be supervised and you have to meet whatever credentialing criteria exist in your hospital. So the other question is, do we run codes? And the answer is yes, particularly if you're working in one of our outlying centers. You may be on with a physician. It may just be you and a physician. However, it's not entirely unheard of that two cases come in at the same time. Maybe a stroke comes in and then EMS calls in and says we're en route with a cardiac arrest. Well, you're going to decide between you and the physician, which one do you want to take? And so you're either going to take the stroke or you're going to take the cardiac arrest. And if you're ACLS trained and if you're comfortable and competent, then certainly as the APP, you can manage that code. So you kind of get the picture that the practice scope is pretty broad, and it can be extremely broad depending upon where you're practicing. And I know that there's nurse practitioners and PAs that will say, I do everything. And then there's others that will say, well, in my hospital, we're limited to just seeing, the most minor acuity patients, or we're positioned in a fast track setting, or we're doing a provider in triage setting where you're probably not going to be managing the patient throughout their entire course of the ED stay, or you're just seeing the quote unquote minor stuff. And I've been in that position from time to time. I'll be honest with you. What's difficult is seeing the so-called minor patient that turns out to be an admission to the hospital. And that happens more often than you might think. So when I'm teaching students, I tell them, first of all, there's no such thing as the minor patient. And secondly, those are the landmines to me, are the people who come in with a sore throat, or come in with a mild cough, or come in with back pain. These are the cases that really get me nervous because, more often than not, it is what it is. The back pain is back pain. They strain their back, and that's it. But we know that in some cases that back pain means a lot more than just a pulled muscle in the back, or that sore throat is going to lead to an ENT consult or worse. And there is much more that can take place in these so-called minor patients. So they actually get me more nervous. The patient that comes in cardiac arrest, or the patient that comes in with a severe neurologic deficit, to me, those are pretty straightforward, and they're probably a little bit easier to manage. They're certainly more formulaic. You can certainly follow an algorithm with those types of patients. You're going to manage the airway and so on and so forth. But it's the undifferentiated, seemingly mild patient that comes into the ED that might be harboring something that you might miss if you're not really paying attention. So that is really the main focus of the emergency nurse practitioner practice environment. So let's talk a little bit about training to become a nurse practitioner working in the emergency department. Well, again, you have to be a family nurse practitioner in every setting that I'm aware of, because more than likely you're going to be seeing kids and you're going to be seeing adults, and you need to have that legal scope of practice to see all ages. Now, having said that, if you are a family nurse practitioner and you've graduated from an FNP program, you may have gotten some training as part of your preceptorships and your clinical rotations. You may have spent some time in the emergency department. And this is where it becomes variable, because you may have gotten excellent experience and you may have been trained in some procedures as a part of that practice, preceptorship. But for the most part, it's extremely variable, and you may not be getting really any emergency department training per se in your graduate program as a family nurse practitioner. In my case, and turning back the clock to 1994, 1995, I begged and pleaded to be able to do some training in the emergency department, and my professors back then said, well, no, it's not primary care, and we will not allow you to spend time in the emergency department. Well, eventually they allowed me to spend a few hours in the emergency department. And during my conversations with the ED docs, they said, we'd love to have you work here, but there's no way for you to bill for your services. And that's the way it was in the early and mid 90s. We had no mechanism for billing. And if there was an NP working in the emergency department, it was a hospital employed NP who was there more or less as, icing on the cake to kind of help move the flow. But it wasn't a revenue generating position. Now, times have changed. And obviously over the last 25 plus years, we have seen reimbursement for NP services in the emergency department, which is great. And that's why I'm there. And that's why I've been working there for as long as I have. But getting back to training, now, if you are fortunate enough to go to an academic program, and there are some that exist in the country that will train you to be a family nurse practitioner and an emergency nurse practitioner, and afford you the opportunity to sit for board exams for both, then you're in a great position. And you've probably gotten some really good training. But what I think is probably the best training, and I'm a little biased here because I run a fellowship program in emergency medicine for nurse practitioners, is if you graduate with your FNP and you want to work in the emergency department, try to find a fellowship somewhere. Now, unfortunately, most fellowships are funded by the departments of emergency medicine or by the hospital. So typically they're paid positions. You do receive a salary, but it's a reduced salary. But in return, you're getting supervised training and you're getting the opportunity to learn techniques such as ultrasound, and you're getting those procedures in. And in most cases, like in our department, you're going to work alongside the interns. I start our fellowship classes on July 1st. And so we blend our nurse practitioner fellow right in with the intern class coming in. And so they'll get the orientation and they'll get the lectures, all of the didactic work right along with the physician residents. So it's an excellent opportunity to learn emergency medicine. And let's face it, as a family nurse practitioner with primary care training, even though there's some overlap between primary care and emergency medicine, they really are two completely different focuses of care. So in our program, for example, and I know most programs throughout the country are similar, is that you'll get the opportunity in a fellowship to rotate not only in emergency medicine, but also in some of the other specialties throughout the hospital, such as orthopedics, ICU. You'll probably spend time with radiology. In our practice, because our Department of Emergency Medicine also oversees hyperbaric medicine, wound care, medical toxicology, and also the pediatric emergency department, and addiction medicine too. You'll get the opportunity to spend time in all of those settings. And I'm sure most other FNP fellowship programs afford you the same opportunity. So when you graduate, and most fellowship programs go anywhere from 6 months to 18 months. My program, I reduced it from 18 months to 12 months so that we could really focus on, just emergency medicine primarily. But you're going to get the opportunity to see a lot of different things. And again, you're supervised the entire way. So that is, in a nutshell, what the training is for an emergency nurse practitioner working the ED. Let me backtrack and say that prior to the development of fellowships and academic programs, most of us were trained on the job. Majority of my training was on-the-job training. So in other words, you learn the hard way. You learn by having to go home and read every night and say, just what the heck did I do today? And, you've got your textbooks out, or of course now today, everything is online, but you also have to do the legwork. You have to go to the lectures. You have to go to conferences, and you need to fill in those knowledge gaps. And even today, me, 27 years after becoming an NP, every day when I work in the emergency department, I learn something that I didn't know the day before. And that's humbling and it's scary at the same time. And it makes you realize that you never reach the point where you're 100% comfortable. You do reach a point where you're confident that I know what I know and I know what I don't know. And if I don't know something, I know where to go find out. And I think all of us, physicians, residents, PAs, NPs, we all reach that point where we're comfortable, we're confident, but we certainly don't know it all. So let me share a few other little tidbits about working in the emergency department. I will tell you, first and foremost, that you will look upon yourself as being an expert at identifying and diagnosing and treating the undifferentiated patient, right? I mean, patients will come in and you don't know them and they don't know you. And it's a process of getting the information that you need from them in order to reach a diagnosis and a treatment plan. And that also involves trying to obtain records and maybe talking to family members. And it's a process. And sometimes people are less than honest with you and you're dealing with that as well. So this leads up to the real challenge of what you do as an emergency nurse practitioner in the emergency department every day. You are very good at eliciting information, performing a targeted physical exam, considering, for example, what's the worst thing that could be going on with this person, because that's really your ultimate responsibility, is to make sure that you don't discharge someone home with a life-threatening condition. So your mindset is much more focused on what's the worst thing that could be happening. That's what we need to rule out. You become very good at diagnosing those life-threatening conditions, or at least excluding them. So this was a brief overview of what an emergency nurse practitioner is, what an NP does, what an ENP is trained to do, and where that training comes from. I'm sure that I've left a lot of things out, but hopefully it spurs some conversation and some questions. So please leave some comments below. Let me know what questions you may have. In this channel, I want to really focus on answering specific questions. So for those that don't know me, I've been a nurse practitioner for 27 years. The majority of that time has been spent in emergency medicine. My first 2 years was spent in a medical intensive care unit when I graduated. Prior to that, I was an RN that worked in cardiopulmonary ICU. That's the open heart ICU. I did that for 6 years. And during my RN training and for a few years prior to that, I was working full-time as a paramedic. So that kind of encompasses a little bit of my background for those that don't know me. And please leave me some questions, and I hope to see you on the next video. Thanks. Bye.